if I gave it all away for one thing? Wouldn't that be something?
Now, this next segment is a hot subject. It's a hot subject on a hot day for hot people, men and women, who are going through menopause. And we have Dr. Lilie on the phone. Welcome, Dr. Lilie.
Hello, thank you.
And Dr. Lilie is with BioHRT. And I know you're on last week and before. Just tell us a little bit, highlight again of what you do.
Well, I am a naturopathic physician, and I work out of BioHRT as a consultant to do bioidentical hormone replacement therapy consultation, but I also see patients in the office as a primary care physician there, so I get to do both things that I love to do.
Now, BioHRT, they're located in Scottsdale.
Correct.
And their number is area code 480-629-8882. Now, what is a naturopath? What is the medicine of that and the philosophy behind that practice?
Naturopathic medicine is a form of primary care medicine. It's been offered in the United States for decades. It serves both as a complement and an alternative to what we know as traditional allopathic primary care medicine. And I would say the biggest difference between allopathic medicine and naturopathic medicine would probably be its philosophy. There are certain tenet that we follow that have to do with finding the cause, looking for the root of the matter, treating the patient as a whole person, doing no harm. We believe that the body has the power to heal itself, and so we try and utilize treatments that allow the body to use its own power to be able to heal itself, and so that's a very powerful medicine.
So today, really, we're not just talking about men and women with with your hormone replacement,
No.
which is what you do, but you're right now talking about what the difference between a Western medicine and naturopathic. Is that correct?
Correct.
Okay.
Correct.
So, how is a naturopathic doctor? How are they trained?
Naturopathic doctors attend a 4-year postgraduate medical program, and we learn both didactic courses, which are courses like you would imagine going to school for, seminars, lectures that include basic sciences. We learn about all different types of pathology, diagnostic testing such as MRIs and radiological reports. We learn how to do gynecological exams, men's health exams, etc. And then we also learn about pharmaceuticals, just as allopaths would. However, what we can do with pharmaceuticals is take people off of them as well as put them on if necessary. But we also do a lot of alternative testing to test for heavy metals and alternatives to mammograms and things like that. And then we use modalities that are safe and work with the body to help heal itself.
This is BioHRT. They're located in Scottsdale, and their number is 480-629-8882. Now, what types of health problems can be treated
with naturopathic medicine? We have both acute and chronic diseases that can be treated. Since we're primary care physicians, you can come to see us for anything you have. We specialize in more chronic conditions like blood sugar imbalances and hormonal irregularities with cortisol, estrogen, testosterone, thyroid. We deal with cancer, hepatitis, acid reflux, yeast issues, lots of different things, mental, emotional issues.
So it's almost like as if you were going to go to a regular doctor.
Absolutely it is.
I mean, even if you had, heart problems, you should be going to a naturopathic doctor.
That's right, and it's very helpful to go, especially with the list of medications you might be on, so we can say, okay, well, these things maybe you definitely need to be on, and these things maybe there's an alternative for, so that's nice for people.
And it's good to have an alternative because in all frankness, really today, I believe that some of these regular doctors, some are just drug pushers. I hate to say it, but I believe it's true.
Well, when you only have one thing in your medicine bag, you don't know what else to give. And so it's nice that we have lots of different things that we can do for people.
That's great. That's BioHRT. They're located in Scottsdale, and their number is area code 480-629-8882. So what kind of treatments do you use?
Well, we have as a core of our curriculum in school nutrition, so we use lots of food as medicine. We do detoxification protocols. We use botanical medicine, which is using herbs like garlic to help heal infections, and hawthorn berry, which heals the heart. We use homeopathy, which is a form of energetic medicine. We do counseling, physical manipulation, and some NDs, depending on who you see, will receive advanced training in certain things like IV nutrient therapy, hypnotherapy, medical weight loss, aesthetics. So there's a variety of different treatment modalities that you might undergo when you visit a naturopathic doctor.
So their number again is area code 480-629-8882. It's BioHRT.com. So what's the typical first visit like?
Well, the typical first visit is rather lengthy because that is the time where we really get to learn about the patient and what they're experiencing. And a lot of times patients really appreciate being listened to. And so that's what the majority of the first visit entails, is just listening to what the symptoms are, what is the history of the case, family history, any other pertinent medical data that we need to know, lab results that might come in with the patient. And we go over everything, and then usually on the next visit you go over a treatment plan based on the information you learned in the first visit. So it's very informational. It lasts maybe an hour to an hour and a half.
And that's good. I mean, it's great. It's because you're thorough. Again, that's BioHRT.com, and it's 480-629-8882. So how often do patients need to be seen?
Well, it really depends on the complexity of the case. I would say initially, if a patient has a chronic condition or what we call a subclinical condition where you have symptoms, but you're not necessarily diagnosed with a particular disease like diabetes, you might just have a blood sugar irregularity, you may need to come in once a month for 6 months, and then once every couple of months and once every few months until you're able to be regulated on your own. So it really depends on the case.
Now, this is an important question, I think, because I know the answer, but I think everybody should know that just because you're seeing your regular medical doctor doesn't mean that they couldn't go to see you. Is that correct?
Absolutely. I work with several different specialists in the allopathic world. We have mutual patients, and that's really the best way to go, in my opinion, because then you have the support from different angles, and you have all of the options available to you from all different philosophies and types of medicine. So that's very common.
And so even if you're on medications from them, maybe you should go to BioHRT and give them everything that you're taking and let them look at what you're doing and seeing if there's anything alternative for you. Maybe you don't need something that they're giving you, or maybe they have something that's a little bit more healthy to take. Is that correct?
That's right.
Great. So that's BioHRT.com. And the number to call is area code 480-629-8882. Now, we were talking a little bit last week or the week before about the IV that you do. I just want to talk about that again one more time because we didn't get a chance to talk about it again last week. Tell everybody exactly what that is, because I love what that is.
Well, the IVs can be a combination of many different types of minerals and vitamins. Depending on the particular case, you want to customize it, but you can put things like calcium and vitamin C and antioxidants like glutathione, and you can really customize it depending on what issue the person is having, whether it's recovery from surgery or hepatitis or cancer. You can customize it, but it's a way of allowing the body to receive the nutrients without having it pass the GI tract, because some people have absorption issues, so you need those nutrients right away, and IVs are the best way.
And the other thing that we were talking about was how it sort of cleans you out, so you go beforehand, possibly before surgery, you will recover faster, or if not, and you hadn't done that, you can also do it afterwards, and it sort of cleanses things out. Is that right? That's
right. It really reduces inflammation and gets all of the toxins and the extra tissue that's built up out of the system much quicker, and you see results much, much faster.
All of the information that you get on this show is extremely important to everybody. Take this number down. It is area code 480-629-8882. It's BioHRT.com. They're located in Scottsdale, and you can be anyone, man or woman, with issues, without issues, going to a doctor, regular medical doctor, taking prescriptions or not. Give them a call and get something natural. It's BioHRT.com. The number is, again, 480-629-8882.
Cross that line.